At present, there is a lot of talk and discussion about the different strains of the COVID-19 virus. Therefore, to clarify these doubts, on behalf of the Health Promotion Bureau, we have invited Dr. Jude Jayamaha, the consultant virologist at the Medical Research Institute of Sri Lanka. Starting off the discussion, sir, what is meant by a new strain of virus? And why do we always see the changing strains of viruses, but we don't see the same in bacteria and fungi?
Viruses are considered to be very primitive, infective agents. In fact, they are not even considered as living beings. When they grow or when they multiply in large numbers, they have spontaneously or naturally, they have so-called mutations, that is differences from their previous virus types. But we do not see this very often in bacteria and funguses because in the evolution process, they are considered as living beings as well as higher than the viruses. As a result, we are seeing these changes or these mutations as new variants in certain viruses, especially in COVID-19 virus.
Sir, what can be the implications of the mutations of COVID-19 virus and how is it likely to affect us?
When mutations occur, it can result in changes in the surface protein of this virus. As a result, these new mutations or these new variants can spread rapidly among a population and it can lead to more severe infections like pneumonia or different organ failures. And when there's a vaccine against the particular virus, they can actually escape the antibodies that the vaccine produce. Or in an event of there's an antiviral drug, they can actually develop resistance to this antiviral drug.
At present, about how many types of strains of COVID-19 virus have we identified around the world?
There are more than 10 variants given according to the Greek alphabet. There are main two groups. First one is variants of concern. That is, of course, we need to be more careful, more vigilant, and we need to study very closely about these variants of concern. They are namely alpha, beta, gamma, and delta. Then the other second category is various variants of interest. There actually we need to study in detail about their spread, about their severe effects, but they do not warrant or they do not actually need to be a highly concerned group. They are actually again categorized or given names according to the Greek alphabet. They are lambda, theta, kappa.
Is there a particular reason that everyone is worried about the Delta variant of the COVID-19 virus? And how is it different from the Alpha or the Wuhan strain?
Delta variant, when compared to the Alpha variant, it has 60%, around 60% chance of highly transmissible nature. Also, it can lead to severe pneumonia. European data has suggested there are many cases has resulted in ICU admissions due to Delta variant.
So finally, can we discuss about the preventive measures that we can take to prevent ourselves from getting the Delta strain?
Whatever the variants, the transmission remains the same. It is mainly transmitted by small respiratory droplets through sneezing and coughing, and mainly by surfaces. If we touch a surface that is COVID-19 contaminated surfaces, and if we touch our nose and our mouth. So main four modalities or four main steps of prevention are wearing a proper mask, covering the nose and the mouth, and of course, as far as possible, avoiding very congested populated areas and remain in the social distancing. And if you are contacted with a COVID-19 suspected or positive patient, and if you having fever, cough, and other suspected symptoms, you need to report or you need to notify the relevant health personnel. Lastly, by washing our hands after using the public transportation or after actually coming from work, we need to sanitize our hand either by soap and water or a sanitizer at least within 20 seconds.
On behalf of the Health Promotion Bureau, I would like to thank Dr. Jude Jayamaha, Consultant Virologist of the Medical Research Institute of Sri Lanka, for coming here and clarifying the doubts on the various strains of the COVID-19 virus. Thank you.